Hey everyone, welcome back to Cincinnati Zoo Tales. I'm Jenna.
And I'm Mark. Thanks to all the listeners for tuning in to another episode. Jenna, we've got a really fun episode today to talk about something that I don't think many people know happens in the zoo field.
Right, yeah, another exciting episode about maybe a new job opportunity for the youngsters out there who aren't quite in college yet or in college who want to work with animals.
But don't know what you want to do,
Yeah. We have three guests today. They each have their own little individual stories. You want to introduce them?
Yeah, we've got a very full house today. We're always excited to have a party here. So talking about one of the latest innovations in the zoo field that the Cincinnati Zoo is kind of leading the way with, we're being joined by all returning guests today. So these should all be familiar voices to longtime listeners of the podcast. Jenna Bowerman, our reptile extraordinaire, Eunice Fromm in our children's zoo, and then Andy Haugen in our cat ambassador program, talking about physical therapy and some of the methods that they use with some of the animals that they take care of. So thank you all for joining us. We're really excited to chat with you today.
Thanks for having us.
Yeah, thank you.
Yeah, so growing up, you think of all these things that you want to be, and you hear the typical, dentist, doctor, teacher. And zookeeping is one that I think a lot of kids know about. But the more podcasts we record, the more jobs I learn about and also think, how did I not know that existed? And there are so many jobs that work with animals, maybe not directly or directly, that I had no idea existed. And so I think it's really cool to hear that there is physical therapy with animals. And it's such an important thing and a well-rounded medicinal option here at the zoo. And so we, obviously, a lot of zoos, so many people care about animals, but here at the Cincinnati Zoo, it's just one more thing we can show everyone that we will do whatever it takes to help our animals, and that includes thinking outside the box. So I don't know if you guys know, I've heard of Denver using a physical therapist before, Denver Zoo. Do you guys know of any other zoos that are working with physical therapists?
I know San Diego, they just lost their very old giant tortoise grandma. She was really cool. They were doing acupuncture with her, and I think some other various exercises, but I don't know the details.
Okay.
Yeah, and that's kind of how this collaboration started, is because we hadn't heard about it at a lot of other zoos. So the three of us have been doing some great physical therapy and decided to do a presentation about it for the zoo here, and then also at a conference we're hosting this week. So to kind of get the message out there that this is something you can do at zoos.
Yeah, who knew?
Yeah.
But this is another option for anybody who wants to work with animals. Maybe you also like medicine, or you want to go into physical therapy, but it would be the best job ever if you combined it. This is a thing, and I'm sure it'll be more prevalent soon enough. So, some of your animals needed physical therapy. As Andy mentioned, there will be Cincinnati Zoo is hosting a conference next week. So you guys are doing a presentation. So they've been talking about their cases each a lot lately, and we wanted to share it with everyone. So not just zoo employees or people that work at other zoos. Super cool thing that we're doing, and there's a potential for future careers that I think a lot of people would probably be interested in. Who wants to go first? Do you guys want to do the opposite order of your presentation? Do you want to go
testing us, Jenna? Are you feeling it?
Oh, it'd be me. Hey guys. Jenna here. For my particular story involves around one of our Galapagos tortoises, who, if you guys have come to the zoo pretty frequently, you've probably met during our walkthroughs or our VIP tours. He's the sweetest tortoise, very engaging with guests. About 2 years ago, he's 17 years old, keep in mind, 17-year-old tortoise. We've had him since he was about 6 months old. And about 2 years ago, I noticed that he was starting to limp a little bit. He was dipping his back left leg. It started to become an issue where he was having a hard time getting out of his pool. He was starting to kind of slip a little bit when he really shouldn't have been. So it raised some concerns. So I took it to our vet staff. They started doing all of their diagnostic stuff. They were on it, getting blood, doing all the things, trying to get radiographs, see what's going on. The thing about giant tortoises is really tough. They have very dense shells, so it's really difficult to get the imaging to show us exactly what's going on. So when we kind of reached that sort of hurdle, Dr. Jess, who I know has been on here as well, she mentioned that they collaborate quite a bit with our local med vet. And the local med vet has a giant CT machine. So we're like, well, we've never put a giant tortoise through
So
a
can it
CT
fit a
before.
tortoise?
Can it fit? We don't know. So we did some measurements. Dr. Jess made like a little hula hoop to kind of simulate what the CT would be like, and it looked like he was gonna fit. It was really close, like inches. So we were cut it pretty close, but we were able to get him through, and the imaging showed that he has a deviation in his spine, so similar to what people with scoliosis would see. The difference in tortoises is their spine is fixed to their shell, so it's like you can't really surgically do anything. So we're looking at how do we help him improve his life, or improve his quality of life, improve his mobility, and then maintain that for hopefully 100+ years.
Right, you said 17,
Yeah.
but and
Very
so
young.
for some animals that might feel old, but that is very
It's
young.
incredibly young for tortoises. So it's something that we take really seriously because we want him to, live the best and most fulfilling life possible. So that's when we were introduced to Sean, who is our animal physical therapist that collaborates with MedVet or works with MedVet. And she started doing suggesting some exercises. So Bruno does physical therapy exercises that you might see a dog or cat doing. It's just a little bit slower and more methodical, probably, with Bruno. But he's loving it because he gets food, he gets scratches, and within the first couple months, we saw an immediate change. So he was able to make it out of the pool. He was lifting his leg appropriately, walking like a normal tortoise. So it made us incredibly happy.
That's so exciting. I know if I were injured and somebody told me to do like the exercises at home or something, I would probably not be the best patient. And like I wonder if you would actually see any significant changes, but he was a great patient.
Great patient.
Like how long did you say how long it took before you saw changes?
I mean, it was probably within a couple months.
That's amazing.
Yeah, and so we were kind of amazed because Sean came to check on him a couple months later, and she was like, "Wow, this is an incredible improvement." So that just gave us like the energy to let's keep this going. Let's add different exercises. Let's change up what he's doing to kind of challenge him a little bit more. And then also we have to keep in mind what else can we do to assist him. So if you come by the tortoise yard now, you'll notice that all of the gravel is gone. It's now been replaced with sod, which is a much more comfortable, more natural option for these guys. And we also put some improvements in their indoor habitat as well. Giant mat in there, so less concrete that they're on. And we also put some sod in there as well. And that's something that we're going to move forward with in the future too, just to eliminate them being on hard surfaces all the time.
I've seen videos. I can't remember if I saw them internally or have they been shared on social media of his physical therapy sessions.
Yes.
They have, okay,
Yeah,
because
so
people are probably asking themselves, what does that look like? And that's, I think, obviously all of this is amazing, but for a Galapagos tortoise, imagining physical therapy for a tortoise, I feel like it's really hard
to imagine.
and it
Yes.
feels extra impressive. And I think of the movements being like so slow and tiny. How is it actually making a difference? But clearly it did, and I just think that's so cool. So people can look it up, but
They
maybe
can.
with this on the Instagram story, Angela can share along with each of these so people can view some videos of the physical therapy happening. But yeah, it's super cool to see and amazing that the little things can make such a big difference in his quality of life.
Yeah, and you can see the videos, you can see the purposeful movements that's happening in the exercises with him. Because when we first were like, what does physical therapy in a tortoise even look like? How do you even do that? We did try acupuncture as well, and he did well, but we're just like, I don't know if this is doing anything, but maybe it's something we'll look more into in the future. But yeah, the videos are really cool. You can really see him getting into it as much as a tortoise can. But he does a really great job, and the guests get to watch him because we do him outside as well. So the guests get to watch. I answer questions about what he's doing. And so now he's kind of at a point where, he's got some slow mornings, like we all do sometimes, but then he's going outside, making his rounds, grazing, and acting like a normal tortoise. So it's just about kind of maintaining now. So he'll do physical therapy probably forever, but it's just a part of keeping him healthy, keeping him mobile, especially as he continues to grow.
How often are you doing them? The sessions?
Yeah, so it depends kind of throughout the year. So during the summertime, we have, our walkthroughs, and we also have our VIP tortoise tours get filled up a lot more. So he's a lot more active during the summer. So we'll lessen maybe once or twice a week, but a more intensive exercise. Whereas right now it's kind of our dead season, so we do a little bit every day almost, maybe 4 or 5 times a week,
Okay.
and just smaller sessions, not to wear them out. So.
Very cool.
That's awesome, and hopefully, other zoos can help benefit from what you've learned and what you've done with Bruno. Like, you mentioned it's a deviation in his spine. Do you know how common that even is in tortoises? Like,
I didn't even know a tortoise could.
I'd
really
never heard that
have-
before.
I guess when you think about it, like that, you see shell, deformations and things like that. But I never thought of a tortoise having scoliosis.
Mm-hmm.
It's just not something that we really thought about. I think. So yeah, I have no idea. And we wouldn't have known exactly unless we put him through CT.
Which I wonder how often that's been done
Seriously.
around. And I think it's really cool. One of the reasons conferences are so important to, well, obviously lots of professions, but for zookeepers is it gives us a chance to meet with other professionals from different zoos and network, and we could maybe be chatting with them and not in an informal way and be like, yeah, my tortoise had this issue, and Jenna can, they're doing a presentation, but it could be informal in the sense that like, we decided to put it through a CT machine, and people could be like, what? I didn't know that was an option. We didn't either. And it can help animals in all zoos by all of us collaborating and talking and sharing these stories. So yeah. Wonder if anybody else is going to hear your presentation and say we did that too.
Yeah, I know. I'm excited to hear what people think. Yeah.
Cool. Anything else about Bruno that before we go on to? Obviously, you can chime in later, but
Yeah,
did we
yeah,
cover
no,
most
just
of it?
he continues to do great, and we just just like everything, we continue to evaluate his exercises and change them as needed. It's going to be a work in progress, but he's the cutest patient ever. So.
We got a lot of cute patients.
A lot of cute
presentations.
That's right.
Awesome. That's so cool. Eunice, tell us about your animals.
Sure. So Children's Zoo, we have lots of different domestics. And so we have 3 pigs. So we had 3 pigs, Cinder, Thatcher, Magnolia. So they came to us back in 2012, and the goal was helping out in barnyard shows, going on walks around the zoo, red carpet rolls. They all went to Reds games, so very active, very healthy. And we noticed Cinder, so back in September of 2024, which is I think when you guys were working together.
With MedVet.
Yeah, so we were chatting a lot with our vets, because Cinder, we noticed that he was just walking a little slower around the park than the other 2. During the shows, we would notice at times when he would jump up on the stage, we would see a little bit of a stutter step. So it was one thing we just kind of chatted with the vets. And yeah, there was a day where our vet staff came over and said, so we had Sean from MedVet is here today, and she just met with Bruno, and we were wondering if you would be interested in having her just come watch Cinder. And of course, we're like, absolutely. So she came over, and we just kind of talked about Cinder. And so she kind of watched him run through some things, and then she wanted to kind of put together some exercises to have him start doing. I think what she noticed with Cinder was, apparently this happens with horses and other animals, is they just forget about their back legs. Like, they'll be walking, and it's as they age, they just kind of, their back legs, like Cinder would just kind of swing his back legs, and she said she sees it a lot in horses. So the first thing she had us start working on with Cinder was doing cavaletti rails. So just literally setting posts down and having him walk over them. And the idea behind this exercise was, if he's doing this, he has to think about every leg and has to really use his brain to think about his back legs. So we started with some of that, and then we started adding him going backwards through things. So now he's being asked to go backwards and walk over different rails. So we, for about a month, she had us doing some simple exercises, and then came back and saw that he was doing great, so added more exercises. And what's really sweet is, so Cinder's passed away. He passed away last May, but he was a part of physical therapy for about 8 months, and we saw such an improvement with him in those 8 months. We saw him walking faster again. We didn't see the stutter step helping out in the shows. But Magnolia and Thatcher, if Cinder's doing physical therapy, Magnolia and Thatcher were just joining in along for the ride too. So it's been really sweet to see. So obviously, if you take one pig out and ask them to do something, the other 2 are like, it's our turn. So they've been a part of physical therapy this whole time. So Cinder, he passed away last May, but Magnolia and Thatcher, we haven't seen any mobility issues with them, but every month Sean's been like giving us like higher criteria, so it's been fun. We have them like going under boxes, We have this wobble board now where we ask them to go up on this ledge and their back legs are on a wobble board. Then we have another keeper standing on the wobble board, so they're also getting physical therapy. So everyone's wobbling, and the pigs are just working on this like hold behavior. So it's also just been really fun with pigs being so smart. And this physical therapy, to me, is just a fun way to give these animals something different to do.
Yeah.
So we're always kind of advancing the exercises. And again, the hope now is Magnolia and Thatcher, physical therapy is just part of their everyday routine. And so we haven't seen any mobility issues with them. And unlike Bruno, who is 17, our pigs, Magnolia and Thatcher, they'll be turning 14 on April 1st, which that is older for pigs. But these two are still really healthy. But hopefully just physical therapy is just a proactive thing for these two. And yeah, so we're going to keep going.
Yeah, I'm sure it's so fun. It's like mental and physical enrichment for them and so beneficial. But like you mentioned, they're so smart. Something to keep them, just like a new thing to train them because you had them trained for a ton of stuff already. So this is a new idea. And those videos also are super cute. So hopefully you guys can look those up. Have those been shared on social media yet?
So it was great because as we were all getting together and thinking about how we want to do this presentation, we were reaching out to Angela to help her or to have her help us put together videos because she's the expert. So she came and she videoed the pigs for our presentation, and then she had asked if we can share. I'm like, of course. So I know that I think the video that we're going to share, she had recently put out as well. So yeah, I think different videos have been going. I think
I think they just posted one about Chris today.
Okay,
Oh,
great.
nice.
Yeah.
So yeah, shout out to Angela.
Perfect
She's one of our,
Angela's
our
killing
PR
it.
social media rock stars. You've heard her on here a few times, but she's mostly behind the scenes. So that's who we're talking about. And so I don't know. So they've been shared, but the one that I think most guests or people that follow our social media would recognize is Kris, the cheetah that Andy will tell you about, and maybe the most dramatic start to finish for this physical therapy. So they're all super cool stories and like their different way. I love that Eunice the pigs, it's almost preventative care when you don't think of physical therapy as preventative care. But I just think it's really interesting that they're now older than Cinder was and they are still not having any mobility issues. So that's super cool. But
I love that they were like, we're joining in. Like, you don't have a choice. We're coming too.
If one pig does something, they're at the door like, my turn. You just know going in, if one pig's doing something, well, they're all going to be part. So that wasn't even a question, because I remember the beginning when Sean was like, yeah, we can have Cinder work on it. I was like, well, all three of them are just... But she loved it. So then when she comes to watch Cinder, she just watches all three of them. Yeah.
do you notice, this is kind of off topic, but do you notice that each pig picked up different types of training differently or quicker, or is one of them better than all of them at everything?
Every behavior, yes, I feel like they pick up different steps quicker, and then another pig would pick up a different step quicker. I also found that you would usually train in the order of Magnolia, Thatcher, and Cinder, to be honest, because I think Magnolia could learn the quickest, and I feel like I was the weakest trained. Like, by the time I got to the third pig, I figured out what to do differently. So the order was Magnolia, Thatcher, Cinder. So I feel like, but yeah, they would still learn at different rates, but I found myself wanting to train the smartest pig first and then to the third pig. So I'm a better trainer by the time I got to Cinder's session.
Yeah.
Yeah.
That's awesome.
Yeah.
That makes sense. And you were able to keep Cinder even until he passed away in the shows because of the physical therapy, right?
Before we started physical therapy, we were just talking about Cinder. Do we build ramps? What can we do to add? Because we had noticed some of these things. And he was still doing great in the shows, but again, we just saw that minor change. So then once we started doing physical therapy, he was back to jumping up and down and doing everything fine. So Cinder was a part of the shows. Yeah.
That's awesome.
Yeah.
So cool.
Yeah.
Very cool.
Well, Andy, do you want to chat with us about Kris? Tell us about Chris's journey.
For sure.
Yeah.
Yeah, I think like our PR team has been great about sharing a lot of our stories. So some of you may be familiar with Chris's story. She's our 6-year-old cheetah ambassador. She was best buddies with a former guest on the podcast, Remus.
Remus was,
Yes.
That was one of our favorite visitors.
Yeah, that was a good one. So yeah, he is now retired, but Kris was still active running in our shows, one of our fastest runners. But April last year, during one of our encounters, she unexpectedly fell and was paralyzed from the waist down. And so we didn't know what caused it, what happened. We were able to get there pretty quickly and had our vet staff respond very fast, and we were able to take her to MedVet once again because they have a lot of cool technology there as well and a lot of collaboration. So they did an MRI on her and they found that she had an exploded disc in her spine is what had happened. So they kind of described it to us like a jelly donut. Imagine it just burst. And so the good news is when we were there is like there was nothing broken. There was like no like shards or anything like that, which would have required emergency surgery. But that jelly that came out of the donut, so to speak, was pushing up on her spinal cord, which had caused the paralysis. And so all that we wanted to do was to get her back and get her as calm as possible and just hope that over time that inflammation would go down. And we weren't sure what her mobility was going to look like in those early stages. So it was not the funnest time in my job for sure. Our jobs are great, but they can be stressful sometimes as well, especially when we care about these animals so much. But what's great about our zoo is we will do everything we can for our animals. And so, going to MedVet and then Dr. Jess as well is incredible, and she had actually worked on a cheetah at another zoo that this had happened to, because it's not super, super common. And so she was able to really help us and kind of come up with a game plan what we were going to do for Kris. So that other cheetah that she had worked on was paralyzed for about 2 months. So that's kind of what we were thinking with Kris. But then after about just under 2 weeks, she stood up for the first time and kind of surprised us all. So we were like, okay, sweet. What are we working with here? So basically we were just, once we got the clear that she was okay to have some more access, walking on her own, stuff like that. And that's when we decided to pull in Sean as well, because she had already been working with these two and had some great success with that. And so then she came over to start working with Kris. So the thing that was a little bit different is because Kris's was a trauma instead of so we wanted to make sure when we were doing these exercises with her that we weren't pushing her too hard, because we were also, dealing with that healing process as well. So it was that kind of that delicate balance of we want her to regain mobility. And so it was kind of slow at first, but we did a lot of the similar exercises that these guys did with their animals, the cookie stretches where she stretches her neck from side to side, standing up on a platform that's a little bit higher with her front legs to force her back legs to do a little bit more work, which also the pig and the tortoise did that. So it's really cool. The cavaletti rails, our maintenance team made her some cavaletti rails. So she was doing that to kind of get that momentum with her back legs. And so, we just slowly over time, when we were doing it with her at first, it was every day, multiple times a day for those first few couple months. And then, anytime Sean would come back, she'd kind of consult with all of us, and we'd be like, okay, each animal where we're at. And Kris was doing so good, and she was slowly getting more and more mobility. So we were able to then take her on leashed walks. Which is great because I think a part of reason for Kris's success as well is because she was a hand-raised ambassador cat. She was awesome at her ambassador role here at the zoo and had developed super close relationships with us on our team, and knew how to walk on a leash, which is not something all animals know how to do. And so that allowed us to give her a lot more mobility, but also in a safe way, because we didn't want her running for a while until she had healed as well. And so, we were slowly just adding more and more exercises, and she kept hitting those milestones and graduating from those until she didn't have to be on a leash anymore, she was excited, because as much as she loves her trainers and loves spending her time with us, I think she was getting sick of us by the end of it. The end of it there, she was like, I want to be in the yard by myself. Why are you here with me? So she was doing great. And then, it's been about almost a year since that accident, because it happened in April of last year. And Sean came by just last month and officially graduated Kris from physical therapy.
Awesome.
Did you guys do a follow-up MRI?
We did not, but that would be interesting to see. So it basically, what happened is, I'm not a vet, so don't quote me entirely, but that inflammation essentially, so it did kind of heal on its own. So we had she's been on pain meds and stuff, and she was on a steroid for a while and antibiotics and all that kind of stuff. And so now she is still on daily pain meds that she gets for that, which she will probably just have for the rest of her life, maybe. I don't know. We'll see what the vets say. We might try to wean her off of those as well. But so in terms of where she is, if you see her, in any of our videos and stuff like that, you'll notice her tail, it does tilt to the side, and she kind of drags it on the ground. And then when she runs, she kind of has a weird little, it doesn't look like a normal cheetah run per se, but it's, I think, as better than any of us hoped she was going to be.
To say at one
Yeah.
point,
Yeah.
well, there were many different points. We
Yeah.
didn't even know if she would survive, all of
Yeah.
the horrible things, but I think the last time we talked with you, we weren't sure if she would ever run again.
Yeah.
So she's allowed to run, but you guys will probably not run her in the shows on purpose,
Correct. Yeah.
it's
So
like-
if she wants to go run and do a little trot, she can. We're just not going to run her on the lure machine because that goes so fast. We don't want her to go that fast. So we had one of our physical therapy exercises with Sean was actually we tied a lure string onto like a giant cat toy, and so like we would run in front of her. And when we first started doing that, I could run like maybe half the yard and then she'd catch me. Whereas now when I do it, I have like 2 seconds before she catches me. So I'm like, okay, well, you're clearly doing way better now.
So she's graduated from physical therapy, but
Yeah.
will you continue any of
Yeah,
those
so kind of
exercises?
similar. It's going to be kind of a maintenance thing for her. You know, it's always good for her to increase her mobility and her strength. So that's kind of how we're going to do it. We'll do it throughout the rest of her life, probably. She just, actually today, we moved her down to our cheetah habitat where she'll be for the rest of the year. So if anybody wants to see her, she'll be down there. And then, we'll probably do kind of similar to Jenna with Bruno, do some chats down there while we're doing physical therapy. Our enrichment team made her some enrichment with like a graduation cap and a diploma. So we're gonna do a little chat with that for her like graduation from physical therapy. But it's really cool to see like how this physical therapy has worked from the fastest animal to the slowest animal and everything in between. That's kind of the theme of our presentation. And then they've also been able to expand it to other animals at the zoo. I know we're doing after the pigs that Eunice has. We have Franny, our Red River hog, so we've been starting to do the similar stuff with him. I know that the bird show started doing some with their rats, which is cool. And then I think Sabu, the elephant, has also been doing some of it. So it's just slowly expanding. And and we've had so many other teams at the zoo that have helped us out, like, maintenance, like I said, made those rails. We had horticulture with the sod and our awesome PR team sharing it with everybody. That's incredible.
Amazing.
Yeah, wouldn't have been able to do all this without them. So
It definitely takes a village for
It
sure.
does.
For sure. You had mentioned with Kris, like obviously there's a lot of good days, there's a lot of bad days mixed in with it. I'm really curious, like you had said, we couldn't push her too far, right? Because this was a traumatic injury that she suffered. It was tough to find that balance. How did you know? Like, where did you know the line was? Where it's like, we need her to exercise, but we can't have her exercise too much.
Well,
I feel like
Sean did a great job of she doesn't want her to get tired, you know. So that's kind of how we would assess it based off of at the beginning, she could only do very, very short sessions, right? Where she's a little bit slower to come to us, or if she has to do a jump, you can kind of tell it takes her a little bit more, and then we're like, okay, we'll end it there.
Gotcha.
So it was kind of more just us assessing throughout
kind of reading
that.
her.
Yeah, and then one of her more advanced ones that we did was A to B recalls in our yard, and when we first started doing that, you could tell because she had not been moving that fast in a while, so we could tell she was getting tired earlier with that. And so we would stop it, and then now she can do them for a lot longer before she gets tired. She's like, let's go, treats.
I wonder if, because if you had a tell for your pigs as well, because it's obviously about observing your animals. Because for Bruno too, having to know, Sean would show us this is kind of how you know when he's getting a little tired. And one of them is one of his exercises is just an isometric weight shift. So he stands there really tall, and I give some pushes to his right side. And so if he's bracing himself really, really well, we're doing well, we're doing good. He's having a really strong day. But if we did a couple exercises and let's say he's just kind of giving a little bit more, that shows me that he's a little tired today, or maybe these exercises were a little much.
That makes sense.
So I don't know if Eunice, you had something similar with the pigs.
I think in the beginning with the cavaletti rails, Cinder was stumbling along, but then once he, I think, learned how to do them, it was the same thing. After 6 or 7, if he starts to stumble, okay, that's the most we're going to do. But then you also monitor, but as he gets stronger and better, okay, we can do 8 to 10 now. So same thing, it was always a fluid situation.
Right.
But yeah, exactly, you didn't want your animal to get tired, but you want to make sure you're still pushing them, that they're getting better. But it's a gray, it's a tough thing. And I think it's just knowing your individual animals really well and knowing where to push, but where to be that's good. But also we push to make improvement, but not push too much.
Yeah.
Right.
And you never know if you're doing
sometimes
it
it's hard. It's a hard line sometimes, and you just have to.
I feel like training in general is
For sure.
I want to keep going. Should I, or should I stop and not push too hard?
Well, and I think that's the cool thing about this presentation too, is it is about physical therapy, but it's also about training
And the relationships you guys have.
For sure,
Exactly.
yeah.
Some of these things, these exercises, I probably should have gone into a little bit more detail about what Bruno's exercises are, but, we can't ask him to do something he's incapable of doing,
Right.
So one of my favorite exercises he does is we call the tripod, where he literally, he'll bring his foot up, so he'll like balance on 3 feet.
How did you train that?
So it's actually pretty natural for them, honestly.
okay.
So it's a natural behavior that these guys do in the wild when they're reaching for really high branches, for leaves, for high-hanging fruits. So they just do that to stretch a little bit more. So what I did is, obviously, you kind of lead him a little bit, 'cause he's looking for the food, and you just kind of put it where he would want to stretch for the food. And so now he's kind of connected it now. When we start doing this exercise, he starts to kind of lean and lift it anyway. So even reptiles can kind of get a routine down and a training kind of get down really well, which makes it really fun to kind of see them make that connection.
Yeah.
Definitely.
So yeah, I think training is like fascinating, especially when you're dealing with 3 totally different animals, but they're doing very similar exercises.
Yeah.
Which is pretty cool.
I love it. And I feel like we're probably moving away from it, but the old school thought was like you don't train in
Right.
reptiles or whatever.
Yeah.
And that's
Yeah.
obviously not true.
He's doing the cookies just
I
like
know, it's
the
so
other two.
cool to see the videos of like
Changes,
all
yeah.
of these animals doing the cookies like next to each other. It's so cool.
It's amazing. It really
Everyone
is.
had it a slide with them all doing cookies together.
Maybe we still can.
There's
play
still
them at the
time.
same
There's still time. What do we got?
Run it at the credits.
Yeah.
Oh, that'd be cute. We should totally do that.
And Bruno's one rep is Cinder.
Yeah,
Chris's
it's
six.
Yeah,
like
it's
this.
very
Back
slow.
and forth, back and forth.
Oh, speaking of time, we are short on time, so I wanted to ask you guys the final question. What can I do? How can I be a better steward of the earth? Is there anything any of you do at home that is good for the environment?
Well, I use bar soap, and it's really great for the environment because you're not using plastic. So,
We're giggling because we chatted about this a little bit before. Mark and I always make sure our guests have a what can I do in mind. And I had said, do any of you use bar shampoo? And Jenna and Andy very enthusiastically were like, yes, I have used it my whole life. And I was like, wow, like, I don't know anyone else who uses bar shampoo. And I thought it was kind of a new thing, and they were like, yeah, I've used it my whole life. Like, yeah, like, what do you mean? What, I don't understand.
for eczema.
And then I
Yes.
was like, what did you, like, you guys been conservationists your whole life? And they were like, I use it. I was like, what reasons do you use it for? So we're laughing. I hope Jenna doesn't mind. I'm giggling at her
I don't mind
expense.
at
She's
all.
like, well, I was like, what are your reasons to share with the guests? And she was like, well, it's really good for my eczema. And Andy's like, yeah, I've used it too. Immune Eunice, and Mark's like, I don't know what bar shampoo is.
Never heard of it.
And
Never heard
Eunice
of
and
it.
I, anyways, but it makes the same exact point. Is
Yes.
bar soap, which didn't come to my mind, but is been
That's
around
what we were
forever.
thinking.
Yes. I had no
Jenna
idea
and
what
I
bar
were
shampoo
thinking
was until now, but I will get some.
Well, yes, and then that reminded me that I have used bar shampoo and conditioner when I travel. It's super great because you just use it and it's so much lighter and it's not a liquid,
Yeah.
so you
Yeah.
can take it in your carry-on.
Ooh.
So there
Yeah.
are like environmental and eczema benefits for using
You have eczema. Use it.
bar shampoo or bar soap, which I'm guessing a lot of people use bar soap. But so yes, you mentioned, but it's it's significantly better than liquid shampoo because it eliminates the plastic packaging, it reduces water waste, has a lower carbon footprint due to the lighter shipping weight, and they're usually formulated with more natural and biodegradable ingredients. So Jenna and Andy are rock stars. They've been using bar soap forever.
Bar soap.
But I just was like,
I was thinking we were talking about bar shampoo. I've been using bar soap my whole life.
Well, look at that.
okay,
Wow.
and to make fun of myself, I thought I was so great using bar shampoo years ago, like ahead of the game, but I've never once used bar soap.
Really?
What?
So I need to change that.
Wow.
Crazy.
You should try it. I'll
I'll say,
never go back.
I definitely need to change my ways and move to bar soap. I was unaware of this, and I need to learn what bar shampoo is. So,
It's all learning today.
Apparently we all do.
I have lots of questions about is shampoo even that different from soap? I don't know. My
That's very
sisters will
true.
say
That-
yes.
that could be a
you
whole
know,
nother
I get the cheap stuff,
session.
but I feel like it's just like bar soap, but you just rub it on your head, and it supposedly has better ingredients for your hair.
I'm gonna get some next
Yeah.
time I'm at the grocery. Yeah, I
You
gotta
might
make the
have to
switch.
special order it. I don't know if it's that common, or go to
Okay.
like a hair care store or like maybe a beauty type store.
I think I got mine online.
Online. Yeah,
Okay.
I
Yeah.
ordered mine online,
Yeah.
but I don't know if you can go to like Kroger and get
Okay.
it, where you might order regular shampoos. Bar soap,
Bar soap for sure.
Shout out to
Costco has real good deals.
Oh, I was gonna
Real
say,
good
shout out
deals.
to Eczema Honey. If
Yeah,
you have eczema.
nice.
It's really good soap. It's made with natural ingredients.
Oh man.
Well, thank you all for being here. I'm excited to watch your presentation next
Yeah.
week, and I hope everyone looks up videos, and we'll
Yes.
definitely, I think Angela would do it already, but ask her to share some of these physical therapy exercises along with the stories when we share this episode out. But yeah, anything else? You guys good?
Yeah, kudos to all of you, because I know that the amount of time and effort that these exercises take place, it's also just such a testament to the relationship you have with your animals. So like, I'm proud of you to be a part of the zoo here and hearing the stuff that you all are doing.
Thank
So
you. And yeah, kudos
to
to
you.
all our animal patients. They've been
Yeah.
rock stars.
Yeah.
They
this
really
whole
have.
time.
Seriously.
Yeah, and shout out to vets too. Shout
Yeah.
out to vets.
That staff's
yeah.
amazing.
Yeah.
All right, well, everyone have a great week. Thanks, ladies.
Check out that bar shampoo. Check out that
Bar soap.
Until next time.